Hey guys, this is Thomas from Nurse Money Talk. And in this video, what I want to do is let's discuss this question of can a nurse hold or refuse to give a medication to a patient? Now, before I get started with that though, if you aren't already subscribed and you want to get notified whenever I release more nursing topic related videos, make sure you hit that subscribe button and make sure you hit that notification bell so you do not miss any of my upcoming videos. Also with that, if you find this video helpful, I would really appreciate if you would hit that thumbs up. Thank you so much. Let's get down to business, which is, can a nurse hold or refuse to give a patient a medication? Here's the deal. As a nurse, you have a duty to ensure the safety and well-being of your patients. If you notice a patient or you think a patient is going to have any ill effects from a medication that you're going to give them, you have a duty to hold that medication, contact the physician, and get clarification on that order. And because if you remember, as a nurse, you're also called the patient advocate. And so if you just think about it, if you know that a medication is going to cause issues, then you wouldn't just give it. You're going to clarify the order. You're going to find, get more information on that order, because in general, here's the thing, these are people that are making some of these decisions, whether it's the physician that's writing the order or the pharmacist that's supposed to be verifying the order before approving it, and then you then pull out the medication and then give it to the patient. And even though there's a lot of checks and balances with tech that kind of helps keep a lot of this to a minimum, notice that the key is that it keeps it to a minimum. As for holding a medication, honestly, from what I have seen, more times than not, you typically don't have this. I feel like more times than not, actually, you typically don't have this a whole lot, because from my experiences, the typical medications where you see nurses might want to hold a medication for the patient condition. So I'm thinking the two that I'm thinking of in particular, which is insulin for managing blood glucose, and blood pressure medications. There's usually parameters in there within the orders that then kind of say, if blood sugar is less than this, hold it. If heart rate is, or not heart rate, yeah, it could be heart rate or blood pressure. If it's less than this, then hold the medications or something like that. So I typically don't see too many issues like that. Now, if you do have a situation where you get an order and there's no parameters, but you don't think the patient should get it for safety reasons, then of course, by all means, take a step back, promptly notify the physician, make whatever documentations you need to make, and then go from there. Make sure, not just listen to, some random guy on the internet or YouTube or whatever, but make sure since you're watching this, make sure ahead of time what your facility protocol, what the protocol is for handling situations like that. And then just kind of follow that up the chain of command. Make sure you just do what your facility policy says. And so with the holding medication, I will say that typically I haven't seen nurses really get too much of it's kind of 50-50 in general. Sometimes, it seems like, from my experience, sometimes the nurse wins, sometimes the physician wins, whatever. But the point is not for you to win and for the physician to lose. All of that is irrelevant. The point is for the patient to win, for the patient to get the right care, to get the best care that they can have, and to get a safe hospital stay as well. So that is the primary objective, regardless of who wins or loses between the physician and the doctor, is completely irrelevant in that. Now, as for the holding the medication, or not holding, but as for the refusing to give the medication part, so typically the scenarios I've seen with that is like, so let's say you get the order, right? Give X, Y, and Z. And so you look at it and you say, I don't think this is correct. And so you call the physician, and you don't think that is the correct, that order is still correct, and the physician doesn't agree with you and wants you to still give it, and you're not okay with that, then once again, that is you needing to know what your facility protocol is in that instance. Like who are you supposed to talk to at that point? From my experience and from what I've seen done, it is typically like, maybe following up with the charge nurse, or like maybe you're in a situation where like you're a new nurse and you're just not comfortable, you're just not sure, looking at, double checking with a charge nurse or a senior nurse. If you don't agree with them, or they agree with you that something's wrong, once again, see what your protocol is. Maybe it's a situation where at that point you probably need to escalate it to your nurse manager and then move on from there. I think, if I remember correctly, a while back, there was one that happened that I was aware of that I think got moved up to where, wasn't it like, I think it was like maybe like the chief of medicine or something like that. Like they had to even go, they went above the physician because they didn't agree with the order. I want to say that they ended up like siding with the nurse on that, but I can't really, I don't know, it was such a long time ago, I can't really remember. But the point is though, is that you need to remember that you are the last line. Like when it comes to medications, I mean, once it kind of flows through, you're pretty much the last line, from that medication getting to the patient. And so it's something that you should take seriously. Make sure you're doing good documentation. Make sure you know what your facility protocol is, and make sure you're following that as well. But yeah, that is all I got. Thank you so much for watching this video. Don't forget to hit that thumbs up button, and I will catch you very soon in that next one.